My name is Dr. James Avellini. I'm a physician and cosmetic surgeon. I've been teaching with Empire Medical Training for over 10 years, and I'd like to take this time to present an instructional video on how to decap and place a syringe on the Dermal Filler Belotero Balance. The reason for the instructional video is there's a weakness in the design of the syringe of this product that requires attention. The problem that we see frequently in our courses and our classes is the fact that the syringe was designed and manufactured with a Lure-Lock hub that is not permanently attached to the syringe. And inappropriate tension, torsion, and pressure on this hub without stabilization can cause the hub to disengage and the inability for you to inject the product, and if done inappropriately, can cause the product to be deposited on the patient's face or in their eyes while the needle remains protruded from the patient's skin. So this instruction is to give you step-by-step directions on how you should handle and address the concern regarding the hub on the Belotero Balance needle. So at all times when manipulating this syringe, you need to place your index finger and thumb on the hub of the needle with direct pressure so that it does not move while you're manipulating the cap and the needle. The first thing you want to be aware of is removing the cap will turn counterclockwise and removing, holding the hub and the needle firmly in your hand between your index finger and your thumb. The next point of treatment, and probably the most important, is placing the needle on the syringe without disengaging the hub. After removing the cap from the needle, you need to refirm and repurchase and firmly capture the hub between your index finger and thumb and place the hub of the needle into the Lure-Lock, turning it securely until the cap of the needle touches the hub of the syringe. At that point, you want to continue holding the hub and use pressure to remove the cap before injecting. And also, before injecting, you want to prime the needle so that you develop a little bit of product at the tip before injecting. You don't want to inject any air into the patient. You can replace the cap of the needle prior to injecting and preparing the patient. All of this should be done as usual in all patient care with good aseptic technique and sharps control, never recapping the needle after it's been used, and always placing the sharp in a sharps container so that it doesn't contaminate or puncture another patient for contamination. You need to be aware of these instructions. Anything less than that, with complete capture of this hub and manipulating the cap and the needle and placement of the needle on the hub, will result in this Lure-Lock hub becoming disengaged from the syringe. And when that occurs, you have no ability to reattach the needle to the syringe, and there's a good chance that you're going to lose your product while pressuring the plunger. So remember, capture the hub with your index finger and thumb while manipulating the needle or cap in any position, and you should have no problems. I hope you use this and it helps you with your injection. Be safe, be clean. Thank you very much.